Mvskoke Radio here on 1240 The Brew in beautiful downtown, somewhat cloudy Okmulgee. All right, well, let's go ahead and get to it. This is a subject that unfortunately haunts our people still after decades and decades of work trying to come up with ways to prevent suicide among our people. We have some of the worst numbers in the country and the highest rates. But here to talk about that is Jill. Thank you, Jill. We appreciate you coming in at kind of the last minute there.
No problem at all. I really appreciate the opportunity to talk about, the epidemic of suicide among our Native people within the state of Oklahoma and, within everybody nationally, even worldwide.
Okay, first of all, let's get an idea of who you are with your program, GLS. What does that stand for?
GLS is the Garrett Lee Smith Memorial Suicide Prevention Programs. There are a lot of prevention programs out there, but this one is unique in that it was established into national law. What had happened was a U.S. senator's son died by suicide, and that affected him so that he saw the necessity to establish programs nationwide for the prevention of suicide so nobody else would have to go through what he went through with his son.
Now, during my career as a reporter of about 40 years worth, I've always had to deal with this subject. It never goes away. And most of the material we've had to share said that our people suffered disproportional rates of suicide. I mean, we're way up there in the numbers. It just doesn't seem fair to me, but I don't think fairness has much to do with it. But do you have some idea of where we rank, so to speak?
Well, let me give you some of the national statistics first. In the United States, there are approximately, and I'll round the numbers off, 13 suicides per 100,000 people. Now, in Oklahoma, we have a little more than 21 suicides per 100,000 people. We ranked number 8 in the nation. Now, last year, we were number 7, so we actually dropped in the rankings. However, the number of suicides rose. So you would think that that would have gone down, but that's just not the case because the suicide rate is rising nationally every single year. Now, in Oklahoma, I just looked at the suicide rates for Native Americans this morning, actually, and even though we have 21 per 100,000 people on average, our Native American suicide rate in the state of Oklahoma is approximately 30.2 people per 100,000, which is significantly higher than the general population.
I spent a number of years in Alaska where the rate just became incredible. Mm-hmm. In a matter of a couple of months, it seemed like there were at least 5 kids who committed suicide for different reasons. And, people were stunned, shocked. Statewide, the government, said, we got to find a way to deal with this. The Mvskoke Creek Nation has experienced a few of these cases itself. Now, are we topping the list, so to speak? Where do this particular tribe set among those numbers?
Well,
do we have those numbers?
We are, unfortunately, high. It is so difficult to gather the numbers among our people because so many people go to so many different places when they're experiencing suicidal behaviors or even when they die by suicide. It's not always documented by the tribe. So it's very, very difficult to get those numbers according to which tribe the people belong to in Oklahoma. That is something I just discussed with a colleague this morning about how can we gather that data. So it's just increasingly difficult because sometimes they will come through our Creek Nation hospitals and clinics. Sometimes they will go to the publicly funded clinics. They don't all come to our behavioral health system. And just because we're spread out in Oklahoma, it is really difficult to gather that information. However, I can think of at least 5 in the past few months that have occurred.
The challenge, I think, still that I've seen is that many people or families don't want to come forward and deal with the topic. They say, well, he had an accident, or his drug overdose was not what he had planned, and unfortunately, or he was cleaning the gun and it went off, kind of thing. Is that still one of the challenges your department has to deal with?
Absolutely. There is such a stigma associated with suicide. People want to sweep it under the rug. They don't want to talk about it because they consider it an embarrassment for their family, a loss of honor. Their pride won't allow them to say what actually happened. Many suicide deaths are not documented as such. I can think of one in particular where a person died by gunshot, a self-inflicted gunshot wound, and that was actually documented as a drowning.
Oh,
so there is really a lot that we need to do in regards to helping people start the conversations, decreasing that stigma, and make it a part of everyday conversation so people aren't embarrassed. Because the more we talk about it, the more we can work toward the reduction of the number of suicides. And oftentimes, the medical examiners don't know that it was a suicide. It's not conclusive because it doesn't look that way, because there are so many accidental deaths.
Yeah.
So we are working to help destigmatize the topic of suicide.
The topic of religion is, I'm not casting any aspersions anywhere on anybody, but among the Catholic Church, it's a mortal sin, still, I believe, and other religions, the Protestant Christian faiths, look down on it as, I don't know, a weakness perhaps, or another sin against God, because God created you and He's the one that should take the life that He gave you, kind of things. Do you run into that, or do you perhaps even suspect it in any of these cases?
We do run into that, and that again is all part of the stigma.
Mm-hmm.
That is why we are trying to change the language with which we speak about suicide. We don't like to say commit suicide because that implies such negative connotations, which indeed it is a tragedy. But when we say commit, we think of committing a crime or committing adultery. So we like to say died by suicide. And what we're trying to let people know that suicide is actually a mental health issue, and trying to get the word sin taken out of it, because this is what people tend to view as a solution to problems that they just can't figure out.
Mm-hmm.
They may have lost their jobs, they may have had relationship problems or substance use problems, any other type of problems that they experience, they just can't seem to work their way around it. So they view suicide as a solution. Then, of course, there are those suffering from mental health conditions such as depression and bipolar disorder, schizophrenia, even other serious conditions, and they just don't want to live with that. They don't see how they can get past it. And oftentimes their thinking is not logical. They're not able to stop themselves. And there is a majority of people who have major depressive disorder who have considered suicide at one time or other.
I always end up coming back to that movie with the late Robin Williams. And I can't even remember the name of the thing, where he was talking to some people who were discussing the situation. I think his phrase were suicide is a permanent solution to a temporary problem. Meaning, I presume you can always find a way to solve your problems or deal with them, but if you go this other way, then it's all over.
Well, and that goes back to the stigma of seeking mental health treatment.
Mm-hmm.
Many times when a person is considering suicide, they are embarrassed. They don't know how to broach the subject. Even if someone has a family member considering suicide, they may be opposed to seeking behavioral health treatment just because they don't want people to know about it. But many times, most of the time. If we can get a person talking about their feelings and just ask the question, are you considering killing yourself or taking your own life? However you ask it, they're going to be very open to talking about it. They're going to experience relief because it's something they really need to talk about. But again, they just don't know how. It is the hardest subject that anybody can ever discuss. But that's why, again, we're trying to start these conversations and get people who are not considering suicide to be more comfortable asking the questions that need to be asked to these people who they suspect may be at risk. And you know what the quote you had from Robin Williams, again, that goes back to that being the solution to a problem that people just don't know how to deal with. They don't think they can get past it because everybody's point of view, their worldview is different, and what may seem like a trivial problem to one person could be a life-changing issue to another person, and it really all depends on their frame of reference.
In your experience, what were some of these reasons that you might have heard from people who are considering such a dramatic act? Is it all emotional ties? Is it all the loss of job kind of thing? What have you heard?
There are many, many reasons that a person might decide to take their own life. Some can, of course, include job loss. Relationship problems is one of the highest ranking factors in someone considering suicide or actually attempting suicide. It could be an unwanted move, relocating. Among our young people, that is a huge issue when they are uprooted from the community they know, their friends, their schools, their comfort zone, really. Because when you think about it, young people don't have the expanded worldview that adults do. They tend to grow up in smaller social networks, and they haven't yet experienced life outside their area of school and their friends. So if they're moving to a new school, that could be just a world-ending problem for them. And also breakups are a huge issue. People who are in domestic violence relationships, people who have been diagnosed with terminal illnesses. I actually know of an example that occurred with my father, who worked with a man in his organization that was a custodian. My dad is the nicest guy you'd ever want to meet. He used to talk to this custodian every single day. Just even if he just said, "Hi, how are you doing?" He would ask him about his family, what his interests were. One Friday afternoon, my dad was leaving work, and he said goodbye to this gentleman and told him, "Have a good weekend. I'll see you on Monday." Monday morning came round, and he saw the gentleman again, and he said, "I think you saved my life this weekend." And my dad said, he was dumbfounded. He said, "What do you mean?" He said, "Well, I've just been diagnosed with MS, and I could not figure out how I am going to live with that. But you were so kind to me, and I look at you and the way you interact with people," because my dad has a physical handicap as well. So he's a great example. But he said, "I actually purchased a gun this weekend and was going to shoot myself."
Gosh.
So sometimes just a smile and a kind word can help prevent suicide.
You mentioned guns there. I'm curious to see if you have some handle on the methods that people employ.
Right. Guns are the number one method of suicide among men, and actually among everybody in the United States, because they are lethal means. And we talk about lethal means, when we're doing our suicide prevention work. One of the things our program does is we pass out gun locks. And you mentioned the epidemic in Alaska. The GLS grant that we have here with Mvskoke Nation is among tribes throughout the country. And I had the opportunity to speak with someone from one of the Alaskan GLS programs. They actually give gun safes to their people. They have the highest number of guns, I believe, per capita, and also one of the highest suicide rates.
Right.
So the second leading cause will be overdose. That is actually the number one cause among women. And it is one of the suicide methods from which people can be saved. And women are more likely to do that, not necessarily because they want to be saved, but it is possible for an intervention to occur to avert that suicide.
So someone in this frame of mind, a woman you mentioned, could just upend a bottle of pills, and then EMS could come along and actually save them through pumping their stomach or whatever.
Right, that's right. And then there's also the newer drugs that can counteract opiates, which include Narcan. So they can give the person that spray, and that will counteract the opiates in their system. So I think a lot of people who overdose aren't quite aware that that method is not always going to be one in which they are able to die by suicide, but it is still huge because there is such an opiate problem within Oklahoma and within the United States.
Continuing in that same vein, we've seen some situations the past couple of years where someone was involved in a car wreck, and the facts as we learned them didn't exactly point to an accident. It's like somebody had some intention there. Does that rank on your list? I mean, using a vehicle?
It absolutely does, and I even know of another situation in which that happened that occurred with a friend of mine who had a friend who started giving away their possessions.
Oh, right.
And that is one of the major warning signs if a person starts giving away prized possessions, like their iPhone or their motorcycle or, grandma's diamond ring. That is a major issue if they're looking for someone to take care of their pets. In that particular situation that I mentioned that occurred with my friend, after the boy started giving, and when I say he was a boy, he was around 18, 19 years old. After he started giving stuff away, he died by suicide in his car. He crashed his car the next day. So oftentimes that's another method of suicide that goes undocumented as a suicide. So even the numbers I gave you earlier, they're lowball numbers. I strongly suspect, I know that the numbers are so much higher than what are reported.
The statistics for Native Americans nationally are somewhat available. Do local law enforcement or medical resources keep any kind of tab on Native American or African American or Caucasian?
We do have statistics on by race. Nationally, actually, white males rank number one, but that's not the case, of course, in Oklahoma. We have statistics on African Americans and Asians and Hispanic people. Those are all relatively low. And a lot of that might be because they have a very strong faith-based community and extended families who provide support. And that is not always the case among our Native American people. A lot of times they might feel isolated and alone. They live in more rural areas and don't have as much access to behavioral health care.
You mentioned rural there. Does that location make any difference? Are there higher numbers in rural areas as opposed to urban areas?
I think the percentages make a big difference because we look at the rural areas which are less populated as big cities might be. Now, I do know in Oklahoma, Tulsa and Tulsa County have the highest rates of any other area, and that is part of Mvskoke Nation's jurisdiction. So we have a lot of people there.
When someone decides to seek help, first of all, they've got to make that decision to do that, which has got to be a huge hurdle. What do they bring with them, so to speak? When they contact your agency, what happens? Is there someone who answers the phone and starts to counsel, or do you refer? And what's involved in the next step there?
Well, usually a person they can call in to our agency. We even have some people walk in to behavioral health or to the emergency room. We like to have a clinician available to see them. And usually if a person is experiencing suicidal thoughts or behavior, we can get them in right away. And hopefully the therapist can manage that situation well enough that they won't be feeling that way anymore. We also can make referrals to outpatient facilities. Usually they would be in the Tulsa area or Oklahoma area if there are no beds available, but we will get them in right away because, again, that is part of our suicide prevention strategy. We are also working on integrating behavioral health care and our primary care. So we're doing a lot of training within our hospitals and clinics to help our nurses and doctors and everybody else who works in primary care to learn to identify those people that they feel might be at risk and to refer them over to behavioral health right away.
We've kind of hit on the subject of identifiers, the red flags, and I know we've had this as part of our discussions in the past on the subject, but I think it's important once again to maybe restate what red flags people might notice or look for or be aware of from someone who's contemplating this act. What should a person look for?
Changes in mood are a big identifier. If someone is normally happy and then all of a sudden they're profoundly unhappy, profoundly sad, that could be an identifier. If someone is having relationship problems, if someone is in fear of incarceration, that is a huge issue because we do have the highest incarceration rate in the United States, in Oklahoma. And minority people, including Native Americans, African Americans, Hispanic Americans are among the highest in our incarceration in Oklahoma. And we also have the highest rate of women's incarceration in the country. And when someone's afraid that they're going to go to jail, that is a huge life issue. Again, also, if someone is experiencing substance use, substance abuse, if they're in a domestic violence situation, if they are expelled from school or fired from their job, if they start giving away their prized possessions, those are things that are red flags. And those are just a few. There are so many, I couldn't possibly list them.
Okay. Now, you say you would kind of receive the call and refer to someone who will take the time to work through these issues. What about if I don't know, perhaps you've had this happen, someone calls and said, well, I'm standing here with this pistol, or, on top of a building or whatever.
Right.
Some sort of negative action is imminent.
It's in progress.
Yeah, and some poor person is, like, as they say, holding a pistol and crying and that sort of thing. How do your staff, your specialists react to a situation like that? What do you do?
Well, the person who answers the phone would call a therapist up. One of the key issues is to keep them talking, keep them on the phone. Then another person will call law enforcement or Light Horse to go to their location, because we've got to find out where they are, number one, and to get someone to go to their location and hopefully get there before they engage in the act.
Is there a discussion that you try to engage them in? Are there topics areas that you feel might be useful in perhaps disarming the situation?
Well, one of the primary factors is to let them know that there is help and there is hope, because a lot of times people think that there is no way that they are going to get out of whatever situation they're in, whether it's an environmental situation, a work situation, or an emotional, a mental health, behavioral health situation. Many times they think there is no help for them. And one of the things that we try to do is convince them that yes, there is help. We want to inspire hope in people, and often hope is help. Help equals hope. We want them to regain hope in their lives, and we want to, intervene in any way that we can.
Right, and you do engage local law enforcement to
Right.
assist you when you feel it's
Right.
appropriate.
And we're working on training law enforcement and light horse especially in how to handle these situations without actually making them worse.
Right. I know one of the dramatic situations we've seen in TV and movie is suicide by cop, quote unquote. Has that occurred here in Creek Country?
Actually, yeah, it has occurred. That I have heard about several instances in which that occurred. And it is just tragic. A lot of times, a person will engage in a high-speed chase. They may actually shoot at police or even just pull a gun on them in order to get them to fire back at them.
So I suppose I would not want to be in that police officer's shoes in that situation.
And it's a tragedy on both sides.
Now, you mentioned the word hope a couple of times, and last week you had a big conference, the Hope Conference, I believe it was called. What was it?
That's exactly right. It was the Hope Conference, and our theme this year was Let's Save Lives Together. And the entire conference lasted over a 3-day period. We had it at River Spirit in Tulsa. And the reason we actually had it in Tulsa is because it's a centralized location. We had people all over Oklahoma attend. We had people from out of state. We even had a person from Australia, which I think was just amazing that we got somebody from there, because they too have a huge suicide rate. We had a lot of focus on our Native American people, building resilience in our culture, because culture indeed can be a protective factor against suicide. When people learn about their history and they learn about our traditions, that can help them to overcome their issues. The Hope Conference featured speakers on adverse childhood experiences, which are the traumas people can suffer during childhood. There's a scale of 10. They can include witnessing domestic violence, being a victim of violence and abuse or sexual abuse, parents who have been incarcerated or divorced, and there are a few more on the list. But the more adverse childhood experiences that someone occurs, the more likely they are to experience mental health issues and even suicidal behaviors as adults.
Have there been any, let's say, results from the conference, something you can point to that perhaps people took back home with them, so to speak?
We had a great response this year. We had over 600 people registered. We're still crunching the numbers over the 3-day period, but we got some excellent feedback. People loved our Native American track. We also had a wellness track that included self-care for professionals, because we really do have a high burnout rate among mental health professionals, because we deal with topics like this every day. We did QPR training. We did the prevention training. QPR is Question, Persuade, Refer, Suicide Prevention Gatekeeper Training. It's a 1-hour training that we offer to communities. We train everybody who comes through our health system. We train schools, so that got a really good response. Basically, people liked everything about the conference, and many said that it was the best conference that they have ever been to. And that includes people within our tribe, people in the public, in the general public, who work for other mental and behavioral health organizations, and they want it to continue. We've got tons of sponsorship offers for next year's conference, which is going to be even bigger and better. We're growing every year.
That's got to be encouraging that it grows. It sounds like more people are becoming involved, or at least aware, and are seeking help and solutions and finding ways to share this material. That's a fairly progressive sign, I'd say. Do you think really that you might have turned any corners there in spreading this information?
I really do believe that we did, because a lot of people, even the professionals, counselors who came, really do have problems discussing suicide. A lot of people don't want to broach the subject. And I think we were able to spread awareness and to start those conversations about suicide. We had one person who told us that when he signed up for the conference, which is free, everything is free, we're going to keep it free in the future as well. But he said it was a free conference, so he was a little concerned that it might not be worth his time. At the end, he told us that if it had cost $1,000 to attend, it would have been worth it. We said that, we were so flattered and so happy that we were able to make that difference. And this gentleman is a professional, and he's a doctor of psychology. And I thought it was just fantastic that we were able to make that kind of impact. And he's not the only one that gave such encouraging words.
Here's kind of an off-the-wall question. You mentioned a representative from Australia had attended. Did they discuss this problem among the Aboriginal people at all? Did they go there?
I did not get a chance to speak with them very much, because they were someone that came with a friend who had already signed up. But I do know that the Aboriginal people have just a tremendous problem in Australia. And again, that is due to the size of the country and all of the rural areas there. People don't have access to care, and that really is parallel to the experience of our Native people in the U.S., is not having access to care. And another little story I know of is regarding the First Nations in Canada. And there was a time within the last year that there was a suicide cluster. In, I think, about a 4-month period, they had something like 400 people express suicidal thoughts. In a single weekend, there were 25 people in the First Nations of Canada who died by suicide. So it was declared a national emergency. And it had to do with them being in an isolated area.
Gosh. And that parallels so many situations here in Native America. Like Alaska in particular comes to mind, where those little villages are in the middle of nowhere, so to speak.
Right. And a lot of that also up north in the far northern United States, they don't have a lot of sunlight. They don't have a lot of daytime hours. It may get down to an hour a day, and they're living in darkness. And that can have a profound effect on a person's psyche.
Right. The village that used to be called Barrow comes to mind on the Arctic Ocean. I believe the native folks have changed that to something in their native tongue, which continues the trend that I'm glad to see. But bringing it back home now, there have been numbers of this tragedy occurred in our country here. A couple of years ago, was it a student and a teacher or something like that walked this bad path? How is our tribe reacting? How big is the resource, so to speak?
Well, we have got 2 suicide prevention programs. We've got the GLS grant and the Meth Suicide Prevention Initiative, and also Native Connections. We have another one, actually. Make that 4 suicide prevention grants. We've got the Zero Suicide Initiative. That is a huge opportunity for us to educate people within our healthcare systems. About 40% of those who die by suicide have visited their primary care physicians or providers within 1 month of their attempting or even dying by suicide. So that is a huge part of what we're trying to do. And, we were talking about risk factors. If a person loses a loved one to suicide, their risk for suicide increases fourfold. So, and approximately 6 immediate family members are affected by each suicide. And in Oklahoma, that's bigger because we have huge families in Oklahoma, and and we're all really close. And at least 25 people are affected by each suicide. And some of the things that we're trying to do are get out, and we provide resources for people. We provide training. We are doing American Indian life skills in our community centers so they can prevent suicide among our youth. That is another great suicide prevention program. Our programs offer mental health first aid, which is a training for community members and professionals to help them identify those at risk. So we have just got a lot going on. Upcoming, we are hosting International Suicide Survivors Day for people who have lost a loved one to survivors. That day is November 17th, but we are going to be hosting an event on the 15th of November, which is a paint party for those who have lost loved ones.
I think it's important there. You mentioned family a couple of times to remember this act impacts a lot more people than just the person who commits it. A lot of folks around him will be affected, right?
Absolutely. And it goes beyond immediate family members. It goes to friends, acquaintances, teachers. It could be their school bus driver. It could be the person they know at the convenience store. It could be their mailman. It could be virtually anybody, because everybody is impacted when they hear about someone losing their lives to suicide. And it could even be people that they don't know.
Mm-hmm, right. Yeah, we've seen that happen so many times. All right. Jill, excuse me there, kind of belching on microphone. Jill Sago, we want to thank you so much, as I say, for coming down almost at the last moment here to help us out. And I've enjoyed the discussion, even though the topic was somewhat somber. Thank you so much for sharing so much information. We appreciate it. If someone wanted to get in touch with you, either for information purposes or they needed help, how would they do that?
Well, they could call behavioral health at 918-758-1930. That is 918-758-1930. 1930, and if they are not in the Okmulgee area, then we could give them the phone numbers to our other locations. Another great resource is the Suicide Prevention Lifeline. The number there is 1-800-273-TALK. That is 1-800-273-TALK, and they are available 24/7. One more resource that we have is the crisis text line, and you may have seen it on the marquee in front of the tribal complex. We've got that running along with the lifeline. The crisis text line number is, we text the word creek to 741-741. Text the word creek to 741-741, and that's a great resource for people who are reluctant to actually speak about it, but when they can get on social media about it, that can really save lives.
Great alternative there. Well, thank you once again, Jill. We appreciate it. We're going to take a short pause here, and we're going to be back with an interview by Jason Salzman regarding the gathering place here in Tulsa. So stay with us here on Mvskoke Radio.
Red Stick Gallery in Mvskoke features items handmade or designed by Mvskoke Creek and Roll Systems.
It was so good, though, I couldn't stop it.
Owned by the Mvskoke Creek Nation, the gallery proudly sells ribbon skirts and vests, Southeastern designed clothing, jewelry, prints, and many other items. For more information, visit www.creeknationgiftshop.com. Red Stick Gallery, located 105 South Grand Avenue in historic downtown Oklahoma.
Oh, yeah,
our
we'd be
station is
happy
giving
to.
the lifeline number out. So, this week especially, we're trying to hit that hard.
Okay.
All right.
Thank
Who
you.
am I? Am I native?
Good
I don't
job.
want people assuming things because I'm Indian. I just want to be me. But how do I live in two worlds? Some guys just check out by doing meth. But that ain't for me. because I see my family, my friends, my drum making, my future. There are a lot of cool things about being who I am, and meth isn't one of them.
Learn more at ncai.org. A message from the Partnership for a Drug-Free America and the National Congress of American Indians.
Okay, I guess you just heard a little behind-the-scenes conversation on an open mic. Nothing like that. At least I didn't say anything really stupid. This next segment is courtesy of Jason Salzman and Mvskoke Vision. He had a chance to talk with a man who's got some background information about who owned the land around the highly popular gathering place.
Tulsa native Russell Cobb is a writer and academic who is currently a professor in cultural studies at the University of Alberta. He's had work featured in everything from Oklahoma's This Land Press to the New York Times. He recently had an article appear in the Tulsa World regarding the new Gathering Place Park and its relation to historic Mvskoke figure Takabachi.
Yeah. Well, it's great to have you on the program. I know recently, the reason we wanted to have you on the program is you appeared in the Tulsa World talking about the Gathering Place and the fact that it's this nice big park, yes, but there are some Mvskoke roots, some deep Mvskoke roots in the land on which it sits. Kind of talk to us a little bit about how you came to writing this article. I know you've got some other projects too, but how did you come to write this article and really what led you to it being published?
Right. Okay. Well, thanks a lot for having me. I just, this is such a passionate issue for me because I grew up literally a block from the Gathering Place, and what we call it Maple Ridge now. It was originally not Maple Ridge at all, and it was a real experience to learn the origins of that land and who it belonged to and the longer history, because I knew nothing about it growing up. No one ever spoke of it at all. And I met a J.D. Colbert, and he told me when I was working on a piece about the Gathering Place, he said, you want to look into a guy named Takabachi. And so I started to research Takabachi and his roots into the land, and that led me on a longer quest to find out more about allotment and the dissolution of the tribal nations around the time of statehood. And that just, it's so shocking to me to know that I never learned that in school, and to really learn it, that I was shocked and then also concerned when I learned more about the Gathering Place and learned that, we've got this thing sponsored by Williams and this thing sponsored by Quick Trip and all these oil companies, but nothing, as far as I could tell, honoring the Mvskoke Nation or Takabachi in particular.
Right, and I think, you're in education, higher education, but education, no doubt. You came up in Tulsa, as you said, educated there, and you talked to other people in the world of academia, I'm sure. As an educator, how disheartening is that to think about now that generations of Tulsans are growing up not really knowing about the true or the original history of their city?
Yeah, it's really disappointing. I mean, I think we're taking the first baby steps forward, and that's promising. For example, I went to, like a lot of people in Maple Ridge, I went to Robert E. Lee Elementary School. That's now been renamed in honor of the Council Oak tree. And those are little steps that we take and we start to rediscover. And I really find that people of my generation, and especially younger, have a hunger for learning this history, because, like somebody said, a writer once said, when you start to learn about Oklahoma history and about some of the crimes that took place that were foundational to our state, which I still love. I'm from Oklahoma. I don't live there anymore, but I still love Oklahoma. But when you start to learn about those foundational crimes, it changes almost the way you relate to yourself and your own identity. It feels like this place is not what I thought it was. And so I think that it's really important for the Gathering Place. It may not be the best PR in the world, but it's very important for them to acknowledge that history and that land, so that we start to move. We incrementally move this process forward.
Yeah, and I know that the tribes were invited out, were a part of the Gathering Places opening. I know some of the, I think some of the representatives from public relations went out there and everything like that. So I can't speak to maybe if there's something in play or if something's going to happen there. I'll certainly have to ask them about that. But I think you make a great point that it is kind of turning, the tide is turning a little bit in favor of more recognition and more education on Oklahoma's real history. Now, you said a writer was talking about Oklahoma history. You, sir, are yourself a writer that's going to be talking about some Oklahoma history. I know you're excited about a book that you're working on. It's going to be a little while before it's out yet, and we'll talk to you then again when it is so we can talk about that a little bit more. But I know that you're diving into some Oklahoma history right now, and it's got to be pretty fascinating for you. I'm sure that we all know a lot, us that research, but you probably uncovered some things even that you weren't aware of.
Absolutely. I mean, some of the things are, we know, and I'm sure anyone who's done a little bit of who's bothered to take a little bit of a cursory look into Oklahoma history realizes that it comes out of some pretty dark places in terms of the swindles that happened of native land. Look, it comes out of a pretty conflictive world. But what's really shocked me, what's really blown me away is once I learned about Tuggabuggie's land, I started to look at other lands. And so I have been meeting with some descendants of people whose allotments were taken. And I mean, not in the distant past of the old Wild West. I'm talking about in courts with lawyers by people whose names are still on the faces of public buildings, of schools, airports, that were instrumental in what our wonderful state historian Angie Debo called a vast criminal conspiracy. And she was a woman who did not mince words, and I don't think she would have said that if it were anything less than that. And it really was a vast criminal conspiracy that was conducted right in by the leading men of Oklahoma. And so once I started to see that it wasn't just this one isolated case of Tuggabudgie, but for example, there was a big case of the Naharkey allotments, the Naharkey family, who had a big part of West Tulsa, 3 different generations of them whose lands were taken because they were actually kidnapped. And for example, one of the girls, she was 17 in 1922, and she was abducted by one of the men of a leading oil man in Tulsa, and abducted and harassed and assaulted until she agreed to sign over the deed to her land. And I couldn't believe this, and I couldn't believe that there was nothing written about it. I mean, there was a lot written about it in the 1920s, but not in my work has been real archival work. I mean, in the most basic sense. Not, you can't Google it. You can't Google it. You have to go to the National Archives. You have to request, and you have to see the records of probate cases to see the paper trail of what happened. And when you start to see it, like, for example, you see the way the white guardians came in and would just have people sign an X and deed over their lands for sometimes pennies. Then those guardians would turn around and flip those very same lands for hundreds of thousands of dollars. I mean, that is just shocking, right? And the thing is that's not just the distant past. And that's one of the things I really want to emphasize, and I want to emphasize in the book, is we might think, well, okay, well, that was 80 years ago, 90 years ago, even 100 years ago, but now we're living in a different reality. Well, we're still, just like we were in the 20s, the teens and 20s, we still have an economy that has a lot to do with oil, right? The wealth of the oil industry. And that didn't come out of nowhere. That came out of that original crime. Now, I'm not so presumptuous to say what I think, that I have all the answers about what should be done about that. But the first step forward is certainly at least acknowledging it and discussing it and teaching it in schools. And then we can start to have a real honest conversation about where to go from there.
That's an excellent point you bring up there, Russell. And also, I was going to ask you, whenever you were putting together some of your thoughts and some of your material to put that piece out in the Tulsa world, Was there any conversations at all that you had, I wonder, with officials of the gathering place, people putting it up, that might lead to you thinking there may be a chance that they are going to give a nod to that history?
Right. I did. Yeah. I mean, I spoke with Jeff Stava, who's the executive director of the park, and he said there are ongoing conversations. He didn't go into details. He said, as you mentioned, Jason, that there was a blessing by some tribal elders that was a private ceremony, and that they have an ongoing conversation about doing something that he said was, I'm trying to make sure I get his words exactly right, meaningful. He said he didn't want to just have a plaque or something, but something meaningful. And so I thought that was promising. Yeah. I think that's the right thing to do. But I mean, we've had this. But here's the thing: like, we've had this park in the works for what, 2014, 2015, maybe.
It's been a project, yeah.
It's getting ready to open in a few days. Like, why is that not ready to go? I mean, they've been able to secure multi-million-dollar donations, have play structures, state-of-the-art play structures created in Germany and shipped over. Why are we just now starting to get down and talk about what do we do about the fact that this land was for generations pertaining to Takabachi, not just Takabachi, but he raised his son. He raised grandchildren there. It was a farm. It was, all kinds of people came through. When the railway came through, he was an old man already, and he really resented that. He tried to fight it in court because it was on his land. He said, I don't want the railroad coming through my land. And they basically swindled him in court and said, no, you leased it to this guy. He said, he didn't know he didn't speak English, so he didn't know what he was leasing, and that happened a lot, right?
Right, yeah.
And so he would try to fight that in court, and he lost, and it went straight through where he used to hunt and fish and that sort of thing. So, I've said, and I know some other indigenous people have said, maybe a start is to talk about that trail that now follows that old MKT railroad line. It's now called the Midland Valley Trail, and it's a wonderful resource. A lot of people walk their dogs and ride their bikes. Maybe we should call that Takabachi Trail.
Yeah.
Maybe we could start there.
Yeah, and I think, talking about it too, that reminds me, you had shared a piece of history, actually. I think it was from the early 20s, maybe, an article that described Takabachi as a surly old man, I think is what it said. I thought that was great. Sullen, I'm sorry, Sullen. And because he was just not having it.
Sullen old Indian.
Sullen old Indian, yeah.
Sullen old Indian holds fort.
He wasn't having it. He was upset, and he wanted people to know, even if he couldn't, tell them that. I'm sure he told it to them in his Mvskoke language, but they probably didn't understand what he was saying. So
yeah, and he was widely known. He wasn't just some guy out there in the boonies.
Sure.
Like, he was connected to all these things. That was an amazing thing for me, as a non-native person, was to learn. I kind of learned a lot of that part of removal, and then the Civil War and territory days and statehood through Takabachi. Like, it's amazing because he lived through all of it. He was born in the Southeast, experienced removal, fought for the Union, by the way. When much of the tribe sided with the Confederacy, Takabachi was one of the leaders with Opis Yohola and siding with the loyal Creeks that went there, and so that's somebody who definitely we should be thinking about honoring, right?
Yeah, for sure. Yeah.
And
the Takabachi, you talk to any Creek that knows the history, very prominent figure, definitely, not only in our history, but the city of Tulsa as well, and somebody that I think, everyone in Tulsa should know the story of Takabachi, certainly.
Absolutely. I mean, it's crazy that we have this divide too. I mean, we've got lots of divides in Tulsa, but one is that this is a story that's well known among Creek people, and I'd be willing to bet that there are maybe one, maybe two other people in the whole neighborhood of Maple Ridge that have heard that name. I've reached out a million times. I said, have you ever heard of this? I've talked to people who've lived there for 40 years. They said, no, we just know, and this is a funny story. They said, no, we just know that in our deed to the property, there's a cloud because of the quote unquote dead Indian.
Right.
They just know that there was a dead Indian that's clouding their title to the land. And I said, well, he's not just some dead Indian. He has a name, and he has a history, and he has a very prominent history. So, yeah.
Well, we certainly thank you, Russell, for coming on and sharing some of that history with us today, and really sharing it with Tulsa, and putting such an article in the Tulsa World that I thought was highly educational, but more so, it felt like, the time is right for somebody to step forward and put together an article like this. So we would certainly thank you for that, just as native citizens, but also as a journalist. It was neat to see, and neat to jump into some of your other writings too. And we're really going to be excited to see your book come out whenever it's ready. So we'll let you get back to work on that. How about that?
Yeah, it's a lot of work. Yeah. I really appreciate it, Jason. This has been fantastic, and thanks for the opportunity to come talk to you.
All right. Thanks so much, Russell.
It was Mvskoke Vision host Jason Salzman speaking with author Russell Cobb about the land underlying what is now Tulsa's famous Gathering Place Park. It's not quite as clear as people think it is. Okay, let's get on with a couple of announcements. We have time for a little bit of this. The Principal Chief James Floyd has declared September 15th and 16th, 2018, as commemorative walk of the Trail of Tears. It's a proclamation that says that between the years 1827 and 1838, our people and many other tribes, several other tribes, were forced onto the walk to leave their land and move to the Indian Territory, which has now become Oklahoma. It recognizes the hardships suffered by the 5 civilized tribes who were moved from the southeast, whereas every year in the month of September, a commemorative Trail of Tears walk and memorial is held in Wilson and Cannon County in Tennessee. And so it is called One Step in the Healing and Recognition of this Tragic Past. Okay, Mvskoke Loan Fund has still got a couple of business boot camps in the works here. Let's see, where are we? Tomorrow in Upmulgee, it's social media and marketing. If you're interested, 9 to 12 in the housing building, first floor conference room. And networking also. Let's see, accounting software, QuickBooks. Tribal conference room on the 18th. So if you want to check that out, it's from 8 to noon and 1 to 5. Give them a call, 918-549-2603. All right, thank you so much for listening to Mvskoke Radio this week. You've been listening to Mvskoke Radio. Join us again next week for more local, tribal, and community news and updates. But